Why is ASA physical status important for safe plastic surgery anesthesia? Imagine preparing for a big event and needing to know how healthy the person is before they step on stage. That's exactly what the ASA physical status classification does for anesthesia in plastic surgery. It helps the medical team understand a patient's overall health and predict how they might respond to anesthesia and surgery. This system was created by the American Society of Anesthesiologists to give a clear picture of a patient's medical condition before any procedure. The ASA classification groups patients into different categories based on their health. For example, a healthy person with no medical issues is classified as ASA-I. Someone with mild systemic disease, like controlled hypertension or mild obesity, falls into ASA Roman II. Patients with more significant health problems, such as diabetes or heart disease, are classified as ASA Triple. The system also includes ASA Roman IV patients with severe systemic disease that is a constant threat to life, and ASA V4 those who are not expected to survive without surgery. There is even an ASA V4 brain-dead patients whose organs are being donated. The classification is based on the severity of medical conditions, not age or the type of surgery. In plastic surgery, patients can have very different health backgrounds. Some are young and healthy, while others might have medical issues that could increase risks during anesthesia. Knowing a patient's ASA score helps anesthesiologists decide the safest way to proceed. For example, a patient with well-controlled diabetes and mild obesity might be classified as ASA Roman II or Triple. This information guides the team in choosing the right anesthesia technique, adjusting medication doses, and preparing for possible complications. It's all about customizing care to keep the patient safe. Research shows that higher ASA scores are linked to increased risks of anesthesia-related problems, longer hospital stays, and more follow-up care. In plastic surgery, where the goal is to achieve great cosmetic results while ensuring safety, understanding a patient's ASA status is vital. It helps balance the desire for a successful outcome with the need to prevent complications. For instance, a patient with a higher ASA score might need closer monitoring after surgery or even overnight hospital stay instead of same-day discharge. Before surgery, the anesthesiologist reviews the patient's medical history and assigns an ASA classification. This assessment influences many decisions, such as whether the patient is suitable for outpatient procedures or needs more extensive monitoring. It also helps determine if additional tests or consultations are necessary before proceeding. Post-operative plans, including pain management and monitoring for complications, are also shaped by the ASA score. It's important to remember that the ASA classification isn't perfect. It depends on the clinician's judgment, so different doctors might classify the same patient differently. It also doesn't consider all factors like the complexity of the surgery or the patient's overall frailty. That's why it's used alongside other assessments to get a complete picture of risk and safety. From an ethical standpoint, using the ASA system helps ensure that only patients who are good candidates for surgery undergo procedures. It supports informed consent by helping patients understand their personal risks. It also encourages the surgical team to follow high safety standards, reducing the chance of preventable problems. Ultimately, the goal is to protect the patient's health while achieving the best possible results. In summary, the ASA physical status classification is a key tool in making anesthesia safer in plastic surgery. It provides a standardized way to evaluate health, predict risks, and tailor care to each individual. By incorporating this system into preoperative planning, plastic surgery teams can improve patient safety, enhance outcomes, and uphold ethical standards. Always remember, the final decision about surgery and anesthesia should be made in close consultation with qualified healthcare professionals who consider each patient's unique health profile.